Get ready to discover the chief nerve of the anterior part of your thigh, the mighty femoral nerve. I talked about this nerve when discussing the anatomy of the lumbar plexus. This nerve is a branch of the lumbar plexus formed by the spinal nerves L2, L3, and L4. It is the largest branch of the lumbar plexus. The femoral nerve is the main nerve of the anterior compartment of the thigh, also called the extensor compartment, as it contains a major extensor muscle of the lower limb called the quadriceps femoris. The femoral nerve emerges at the lateral border of the psoas major muscle in the abdomen and passes downward between the psoas major and iliacus muscles, as you can see here. As it enters the thigh, specifically the femoral triangle, it courses behind the inguinal ligament, laterally to the femoral sheath. Did you know that the femoral nerve is not included in the femoral sheath like other nerves? If you look here, you can see that the femoral vessels are present within the femoral sheath. While looking at the cross-sectional view, it is clear that the femoral artery, vein, and lymphatic nodes lie within the femoral sheath, while the femoral nerve can be seen lying outside the femoral sheath. That's because it's formed behind a special layer of tissue called fascia iliaca. So, we can divide the course of the femoral nerve under two headings. Abdominal course. Origin: the femoral nerve emerges from the dorsal divisions of the ventral rami of the L2, L3, and L4 spinal segments. It runs on the abdominal wall, deep to psoas major muscle. Location: it arises at the lateral border of the psoas major muscle in the abdomen. Pathway: the nerve passes downward. Once it reaches the iliac fossa, it runs between the psoas major and iliacus muscles. The psoas major muscle lies medial to the nerve and the iliacus muscles lies laterally to the nerve. After that, the nerve passes under the inguinal ligament and enters the femoral triangle. It enters the thigh laterally to the femoral sheath. However, it is situated posterior to the fascia iliaca, not within the femoral sheath itself. From here, its course in the thigh begins. This here is the femoral triangle. Muscles such as sartorius and adductor longus make up the boundaries of this triangle, along with the inguinal ligament. The femoral artery and the femoral vein here move inside the femoral sheath. This here is the femoral nerve. So, you can see that after the femoral nerve passes under the inguinal ligament to enter femoral triangle, it lies lateral to the G-femoral vessels outside the femoral sheath. It passes between the groove, which is not very prominent here, between the two muscles iliacus and psoas major. After its very short course in the femoral triangle, often referred to as femoral trunk part of the femoral nerve, the nerve divides into two divisions approximately 2.5 centimeters below the inguinal ligament. In this illustration, you can see the femoral nerves runs deep to sartorius in the thigh. It is divides into anterior and posterior divisions. Both divisions give rise to multiple branches that innervate various muscles and regions of the thigh and lower limb. To study these branches, we will use this diagram. I will talk about the branches in a minute, but let me give you a pointer first. If you get a question in your exam asking for you to describe the course of the femoral nerve, make sure you include all the information that I have taught you so far, from its origin to its termination. Let's look at the branches of femoral nerves now. Like the other nerves of lumbar plexus, the femoral nerve also has a motor function and a sensory function. It also gives articular and vascular branches. Let's go through these branches one by one. If we talk about the muscular branches first, as the nerve begins its course in the abdomen, it gives off two branches. These nerves are to iliacus, which lies in the iliac fossa. The second nerve arises from the femoral trunk in the femoral triangle. This nerve innervates the pectineus, just below inguinal ligament. A branch innervates the sartorius from the anterior division of the femoral nerve. From the posterior division of the femoral nerve, four nerve branches supply the head of the quadriceps femoris. The quadriceps femoris is a group of muscles located in the anterior compartment of the thigh. It consists of four individual muscles: the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. Those were the muscular branches of the femoral nerve. An easier way to remember the motor innervation of the femoral nerve is to keep in mind this acronym: QSIP. I know, it would have been perfect if a muscle starting with the letter T was also innervated by the femoral nerve. I'm sad about it too. How easy it would be to just remember it whenever you lay eyes on a Q-tip. But what can we do? This acronym is not too bad either. See how each letter represents the first letter of these muscle names. Moving on, let's talk about the cutaneous or sensory branches of femoral nerve. From the anterior division, two cutaneous branches arise. These are intermediate cutaneous nerve of thigh and medial cutaneous nerve of thigh. Keep in mind that they are different from the lateral cutaneous nerve of thigh and posterior cutaneous nerve of thigh, which are direct branches of lumbosacral plexus. From the posterior division of femoral nerve, we get the longest cutaneous nerve of the human body. It is called the saphenous nerve. It is a very important nerve, which provides cutaneous innervation to the medial side of the leg and the medial border of the foot, extending as far as the base of the big toe. The femoral nerve also gives two articular branches. One to the hip joint and other to the knee joint, as you can see here. The articular innervation of the hip joint is supplied by the branch that innervates the rectus femoris muscle, while the branch that innervates the three vasti muscles provides innervation to the knee joint. Lastly, I mentioned that the femoral also has vascular branches. As the nerve is closely related to femoral artery, it also receives supply from the nerve. Those are the main types of branches that originate from the femoral nerve. Understanding the course of the femoral nerve is crucial for diagnosing and treating conditions involving the nerve and its branches. By recognizing its path through the abdomen and into the thigh and lower limb, and knowing about the femoral nerve branches, healthcare professionals can accurately identify potential sources of pain, weakness, or sensory disturbances and develop appropriate treatment plans to address them effectively. Some common cases in which femoral nerve neuropathy can be seen are: similar to the discussion about the obturator nerve, the femoral nerve also innervates both the hip and knee joint. As a result, the concept of referred pain can apply to this nerve as well. So, if a disease process is taking place in the hip joint or some injury has been sustained, the pain can be referred to the knee joint and vice versa. The femoral nerve can be injured in stab or gunshot wounds, but a complete division of the nerve is rare. As a result of external injury, many symptoms manifest, including both motor and sensory loss of function. Paralysis of the quadriceps femoris muscle leads to an inability to extend the knee. However, during walking, the lack of knee extension is partially compensated for by the use of the adductor muscles. to test the function of the femoral nerve, which supplies the quadriceps femoris muscle through the L2, L3, and L4 segments of the spinal cord. A technique called the patellar or knee jerk can be performed. This involves striking the ligamentum patellae with a hammer, resulting in the contraction of the quadriceps muscle and the extension of the knee joint. Skin sensation is lost over the anterior and medial sides of the thigh, over the medial side of the lower part of the leg, and along the medial border of the foot as far as the ball of the big toe. The saphenous nerve normally supplies this area. The saphenous nerve, major cutaneous branch of femoral, can also get damaged. Entrapment neuropathy of the saphenous nerve can occur as it exits the adductor canal, resulting in pain within its distribution area. In cases where the saphenous nerve is damaged during a procedure, individuals may experience pain, numbness, or a complete loss of sensation along the medial side of the lower leg and muscle ache. A cut-open procedure or venesection is performed on the great saphenous vein in front of the medial malleolus. This vein can serve as an alternative for blood/fluid transfusion when other veins are unavailable or collapsed. We have finally reached the end of our video. I know it was a long one, but I hope it was helpful in your studies. Next, I will come back with a video on the sacral plexus, where we will discuss the other nerves that supply the lower limb. Until then, happy learning and stay tuned to watch more knowledge-filled videos. Thank you for your support.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.